Everybody, it's Tina, here to talk about 3 more breastfeeding myths. We're on part 9, and we're going to cover 3 more today. So, our first breastfeeding myth is that nighttime feedings are not important. That's not true. It's very important that you breastfeed on demand, and it's easy to kind of skip feedings, especially when baby is sleeping well. But prolactin, the hormone that actually helps with milk supply, is highest at night. Studies have shown that it's highest at night. So very important that you don't skip those nighttime feedings. There is a lot of good information if you want to check into safe sleep when you're breastfeeding. There's a good video that probably is on YouTube. I know that we have it here at the office, and it's about safe sleep. And how that affects breastfeeding and making sure baby is safe. And so it's good information there, because many moms do want to be close to their baby when they're breastfeeding. So try not to skip any feedings, but especially those nighttime feedings, when that prolactin is highest. Very important not to skip those feedings. So that's our breastfeeding myth number 1. Breastfeeding myth number 2 is that if your breasts are not feeling full, that you have little or no milk. Of course, at the beginning, many women can deal with engorgement and their breasts feel extremely full and tingly. But after the first few weeks, when your body has kind of come to terms with exactly what your baby needs, I hear it from a lot of moms who say, I'm afraid that I'm losing my supply because my breasts feel differently. So how they feel is not indicative of supply. So obviously you're watching, as always, for diaper output and weight gain, but don't worry about necessarily how your breasts are feeling as far as fullness. So that's breastfeeding myth number 2 for today. And breastfeeding myth number 3 is that formula helps keep babies' bellies full longer than breast milk. In truth, breast milk is just so easy to digest that that breastfed babies have a lot less gas and belly issues than formula-fed babies. So the fact that your breastfed baby is wanting to eat often is how it should be. That's how it should look, because it's just so much easier on the digestive tract. So breastfed babies eat and digest that so well that they're hungry again sooner. So that doesn't mean that it's better for formula-fed babies to eat less and that their bellies are staying fuller. If anything, it usually can cause some digestive distress. So those are our 3 myths for today. Nighttime feedings are very important. If your breasts are feeling different, that's not necessarily indicative of a supply issue. And number 3, that formula-fed babies are that their bellies are full longer. It's just that it's not as easy to digest. It's not as good for their bellies. It's not as their breastfed babies are hungry more often because it's just such a perfect food. So those are our 3 myths for today. If you have any specific questions or thoughts, comments about that, feel free to comment below. As always, you can call or text or email me if you're my client, and if you need any support, if you have any questions, I'm always available. And I hope you keep up the great work and that you have a wonderful day. And I'll talk to you soon. Bye-bye.